As we grow older, one of the biggest gifts we can give ourselves is good health. And the truth is, you don't always have to wait for a doctor's appointment or a hospital visit to know what's happening in your body. Every senior and every family caring for an elderly loved one can learn a few simple ways to check health right at home. These are not complicated medical tests. They are simple, practical things that doctors themselves recommend seniors pay attention to. Today, I want to guide you through the most important health checks you can do in your own living room or bedroom. By following these steps, you'll be taking control of your health, reducing risks, and giving yourself more peace of mind. So sit back, relax, and let's talk about how you can protect your health every single day without leaving your home. The first category is what doctors call vital signs. These are the most basic signs of life that give clues about how well your body is working. The vital signs include blood pressure, heart rate, temperature, breathing, body weight, and if you have a small device called a pulse oximeter, the oxygen in your blood. These are the numbers doctors always check first because they can reveal early signs of problems. The great news is you can measure most of them yourself at home. Let's start with blood pressure and pulse. If you have a home blood pressure machine, try to check at least once or twice a week, or more often if your doctor recommends it. Sit quietly for 5 minutes before you measure, and write down the results in a notebook. A steady record is much more helpful than just one number. Along with blood pressure, check your pulse or heart rate. You can feel it on your wrist or neck, or simply use the reading from your blood pressure machine. Most older adults should have a resting pulse between 60 and 100 beats per minute. If it's much higher or much lower, or if it feels irregular, that's a sign to speak with your doctor. The next vital sign is temperature. You don't need to measure it every day, but anytime you feel off, tired, or chilly, take your temperature. A fever can be the body's early alarm bell, signaling infection. Seniors are especially vulnerable to infections like pneumonia or urinary tract infections, so never ignore a sudden fever. Breathing is another sign to watch. You don't need fancy equipment, just notice your breathing. Count how many breaths you take in 1 minute while sitting quietly. Most adults breathe between 12 and 20 times per minute. If you notice faster breathing, struggling for air, or shortness of breath while doing simple activities, that is a warning. Finally, check your weight once or twice a week. If your weight changes quickly, either going up or down, it could mean something serious. Fast weight gain might be a sign of heart or kidney problems. Sudden weight loss can mean malnutrition, cancer, or another illness. If you own a pulse oximeter, place it on your finger to measure blood oxygen. Healthy levels are usually 95% or higher. If it drops lower, especially during illness, call your doctor. Now let's talk about food and water. Nutrition is the foundation of good health, yet many seniors struggle with appetite. It's common for older adults to skip meals, eat less than they should, or forget to drink enough water. So the second part of our home health check is to look at daily eating and drinking. Ask yourself, did I eat enough today? Was there a balance of fruits, vegetables, protein, and whole grains? If you notice you are eating much less than usual, losing interest in food, or feeling weak, that could mean poor nutrition. Pay attention to water too. Seniors often forget to drink, and dehydration can sneak up silently. Simple signs include dry mouth, darker urine, or dizziness when standing. If you spot these, drink more water throughout the day. Sometimes, a lack of vitamins and minerals shows up as hair loss, brittle nails, or constant fatigue. These are small signals worth noticing. One easy tool is to calculate your body mass index, or BMI, using your weight and height. This gives you a general picture of whether you are underweight, healthy, or overweight. While it is not perfect, it helps you see if you need to adjust your diet. Remember, food is not only fuel, it is medicine. Every healthy meal you eat is a step toward a stronger body. Our third area is movement and safety at home. One of the biggest risks for seniors is falling, and many falls can be prevented. That's why checking your strength, balance, and home environment is essential. Start with a simple test. Can you stand up from a chair without using your hands? Try it slowly and carefully. If you struggle, it may mean your leg muscles are weak. Next, walk a few steps across the room. Notice your balance and your pace. Are you steady or do you feel wobbly? Do you need to hold on to furniture? Even small changes in walking can reveal early problems with balance, muscles, or nerves. If possible, try standing on one foot for a few seconds while holding onto a stable surface nearby. Balance is a skill that often fades with age, but you can practice and improve it. Also check your joints. Do your knees, hips, or back feel stiff or painful? Stiff joints can limit independence and should not be ignored. Just as important is your environment. Look around your home. Are there loose rugs, slippery floors, or clutter on the ground? Are stairways well lit? Many accidents happen not because of weakness but because the house itself has hazards. A safe home is a healthier home. The fourth part of checking your health at home is your mind, your memory, your attention, and your mood. Cognitive health is just as important as physical health. Ask yourself simple questions each day. Do you know what day it is? Can you recall the names of your children or grandchildren? Try this little game. Pick 3 common objects such as apple, book, and chair. Say them out loud, then after a few minutes try to remember them. If you forget frequently, it might be a sign of mild memory decline. Also pay attention to your mood. Do you often feel sad, anxious, or hopeless? Do you have trouble sleeping or find yourself losing interest in activities you once enjoyed? Depression and anxiety are common in older adults, but they are not just a normal part of aging. They are health issues that can and should be treated. Checking your mental health is as important as checking your blood pressure. If you notice changes, talk with your family or a doctor. Now we come to the most important part, the danger signs that mean you should not wait. If you ever feel sudden chest pain, pressure, or shortness of breath, do not ignore it. This could be a heart attack. If you suddenly feel weak on one side of your body, your face droops, or your speech becomes slurred, that could be a stroke. These are emergencies. Call for help immediately. Other red flags include coughing up blood, rapid weight loss without trying, or fevers that do not go away. If you notice your urine is bloody or very little comes out, that may signal kidney or urinary problems. Any new, severe abdominal pain, vomiting, or swelling needs urgent attention. Fast or irregular heartbeat, fainting, or sudden confusion are also reasons to seek care right away. The message here is simple. If something feels very wrong, it probably is. Do not wait and see, get checked quickly. By practicing these home health checks, seniors can take an active role in their well-being. You don't need to be a doctor. You just need to observe your body, listen to the signals, and act early. These steps empower you to catch problems before they become serious. They also help your doctor because when you bring your notes and records, the doctor can see trends over time, not just one number during an office visit. Think of it as teamwork between you and your healthcare providers. Health is not only about medicine. It's about awareness, habits, and small daily choices. Before we finish, let me share a gentle reminder. If you are listening to this and thinking, this sounds like a lot, don't worry. You don't have to do everything perfectly every day. Even if you pick just a few checks to start with, like weighing yourself weekly or writing down your blood pressure twice a week, you are already doing something valuable. Over time, you can build a simple routine that becomes part of your life. You will feel more in control, and your family will also feel reassured knowing you are monitoring your health. And now, I want to speak directly to you, my dear listeners. If you found this information useful, please take a moment to like this podcast. Share it with a friend, a neighbor, or a family member who might also benefit. And don't forget to subscribe to the channel so you never miss future episodes about senior health, safety, and well-being. By subscribing, you become part of a community that cares deeply about healthy aging. Your support means we can keep creating more content designed just for you. So let's make a promise today. Let's promise to check our health at home, not once in a while but as part of our daily life. Let's promise to care for our bodies and minds with the respect they deserve. Growing older is not just about adding years. It's about adding life to those years. By taking these simple steps, you can enjoy more energy, more independence, and more joy in your golden years. Thank you for joining me today. Take care of yourself, check your health often, and remember, you deserve to live each day with strength and dignity. Until next time, stay safe, stay well, and keep moving forward.